When giving breaths during CPR using an Ambu bag, follow these steps. 1. Prepare the Ambu bag. Ensure the Ambu bag is assembled correctly and connected to an oxygen source with an appropriate flow rate. 2. Position the patient. Place the patient on a firm surface in a supine position, lying on their back. Ensure the patient's head is tilted back slightly to open the airway. 3. Check the airway. Before giving breaths, check for any obstructions in the patient's mouth or throat. Clear any visible obstructions if possible. 4. Create a seal. Place the mask of the Ambu bag firmly over the patient's nose and mouth to create a seal. If necessary, use the EC clamp technique, to maintain the seal. Place your thumb and index finger in the shape of the letter E on the mask, and the remaining fingers in the shape of the letter C to hold the jaw in a chin lift position. 5. Ventilation. With the mask sealed properly, squeeze the bag with your other hand to deliver a breath. The bag should be squeezed enough to make the chest rise visibly but not excessively to avoid overinflation. 6. Frequency. For an adult, deliver one breath every 5 to 6 seconds, 10 to 12 breaths per minute. For a child or infant, deliver one breath every 3 to 5 seconds, 12 to 20 breaths per minute. 7. Observe chest rise. After delivering each breath, watch for the chest to rise and fall with ventilation. 8. Allow for exhalation. Allow the patient to exhale passively before delivering the next breath. Avoid providing breaths too rapidly or forcefully. 9. Coordinate with chest compressions. If you are not working alone, coordinate the breaths with chest compressions. The person performing compressions should pause briefly after 30 compressions to allow for 2 breaths to be delivered. 10. Continue CPR. Continue providing breaths along with chest compressions until the patient shows signs of life, trained medical personnel take over, or you are too exhausted to continue. Remember to follow the appropriate guidelines and training for CPR and the use of the Ambu bag. If possible, receive certified CPR training from a reputable organization to ensure you perform these techniques correctly and effectively during emergencies.